this morning's Health Watch. Ask it early. More answers to your health-related questions.
And here to give us those answers, medical correspondent Dr. Jennifer Ashton. Always nice to see you here.
Likewise, you guys.
Dementia was in the news a lot this week, of course, after Tennessee women's basketball coach Pat Summitt said she had early onset dementia.
Right.
We actually have a question about it from one of our viewers. Here you go.
Hi, my name is Rob, and my question is, when you have an elderly parent who may be hard of hearing or slowing down otherwise, what are the warning signs they may be slipping towards dementia?
Such an important question, and so many of us are worried about this as our parents age. Kind of a good news, bad news situation. The good news is, as a society, we're living longer. The other thing is that we're more aware of signs of dementia. Alzheimer's disease is the most common form of dementia. The bad news is that our society, as it lives longer, we will be seeing more of it. So it is important for people to know the signs and symptoms of dementia. And they're pretty basic, but they basically can include things like problems with language. So if you notice with your parent, for example, that they're forgetting words or they're using words inappropriately on a repetitive basis, that's a big sign. Personality or mood changes, again, once in a while, fine. On a chronic or recurrent or increasing basis could be a sign. And also poor judgment. And we're talking usually about extreme things here. Going out in the middle of a blizzard without a coat on is an example of that. It is important also to rule out other medical causes that can cause a change in your mental status. So injury, infection, medications, you want to get a complete exam by a doctor, and if possible, go with your parent for that.
All right. Question 2, let's go to Facebook for this. This is Mom Brandy writes, with ragweed season here, what's the best way to beat the itchy eyes, runny nose, and headache for a 10-year-old boy?
Well, I saw a patient in my office yesterday complaining of awful seasonal allergies. Most of us think that this is only a problem in the spring. Mid-August actually starts the peak ragweed season, and it can affect children as well as adults. About 20 million Americans suffer from seasonal allergies. So again, you want to try to control your environment as much as possible. Harder when you're talking about a child than with an adult, but obviously stay inside as much as possible in air conditioning with the windows closed. You want to actually bathe your pets often because they carry that pollen and ragweed into your house and then you get exposed to it. You want to shower before bedtime because again, that pollen can settle on your hair, then you put it on your pillow and you're going to be circulating it around your face. Take over-the-counter medications, or if you need to, prescription medications, just be aware that some of them can be sedating. And lastly, you want to consider allergy shots. That can be very, very effective, but again, they need repetitive visits with your doctor for them to be effective.
Okay, we have one last quick one about sleep, something we can all relate to.
That's right.
Here we go.
Hi, I'm Luciana, and I've had trouble sleeping for years, and I was just curious, are there any long-term effects from that?
You're not alone. 40 to 60 million Americans have sleep problems, probably all of us at this table at one point or another. We say it all the time, 7 to 9 hours a night is what you need. If you get less than that, you will see the effects long term. So you want to find out why you're not sleeping well and then deal with it.
Effects on your health, effects on your skin, effects on
Your mood.
I apologize.
your workload.
Just kind of fall asleep right there.
Jen, thanks.
Jen, good to see you.